Have you ever considered what happens inside your body while you sleep? We see the night as a time of rest, of quiet repair, a peaceful pause where our bodies recharge for the day ahead. Many of us, with the best intentions, take our vitamins before bed, believing we are giving our bodies the best tools for that nightly restoration. But what if I told you that this simple, well-meaning habit could be setting the stage for one of the most devastating events imaginable? What if some of those trusted vitamins in the quiet darkness of your bedroom are silently increasing your risk of a stroke overnight? It's a deeply unsettling thought, because we've been taught that vitamins are the very pillars of health, our allies against aging and disease. We dutifully take them to protect our bones, boost our immunity, and keep our minds sharp. Yet the very thing we do to safeguard our future could, under specific circumstances, be jeopardizing the delicate balance that keeps us safe while we are at our most vulnerable. It's a paradox that sits uncomfortably with everything we believe about wellness. The problem is that more isn't always better, and timing is everything. While your mind is drifting in dreams, your body's systems are operating on a different schedule. Your circulation slows, your blood pressure naturally fluctuates, and the internal environment changes. It is within this unique nocturnal state that certain high-dose vitamins can transform from friend to foe, creating a perfect storm within your arteries. And the most dangerous part? It happens silently. There are no warning signs, no alarms going off. It's a hidden danger wrapped in the promise of health. I am Dr. Lucas Mason, and in my more than 30 years of caring for patients who have navigated the complexities of aging and cardiovascular health, I have seen how the line between helpful and harmful can be incredibly thin. I've witnessed the profound impact that small, seemingly insignificant choices can have on a person's life and their independence. Today, we are going to pull back the curtain on this silent risk. We will explore exactly how and why some of the most common vitamins can become a threat while you sleep. This isn't about fear, it's about knowledge. It's about empowering you to make the safest choices for your health, so that every night is truly a time of healing and not of hidden danger. Before continuing, if you haven't subscribed yet, click the bell icon so you don't miss out on any health tips designed especially for you. If you like the video, give it a thumbs up and leave a comment. If not, give it a thumbs down to help us improve. Let's start with a vitamin that many people take for its antioxidant properties, often with the belief that it protects the heart. Vitamin E. It's renowned for its ability to fight free radicals and support skin health. Many people take it hoping to keep their arteries flexible and their circulation smooth, and in the right amounts from sources like nuts, seeds, and leafy greens. It is indeed a valuable nutrient. But here is where the danger creeps in, particularly for seniors. When you take vitamin E in a high-dose supplement, especially anything over 400 international units, or IU, per day, its properties change dramatically. It becomes a potent blood thinner. Now you might think, isn't thinner blood a good thing? Doesn't that prevent clots? It is a logical question, but the body's clotting mechanism is a delicate dance. You need your blood to flow freely, but you also need it to be able to clot effectively if there's an injury. High-dose vitamin E doesn't just thin the blood, it actively suppresses the function of platelets, the tiny cells responsible for forming a clot to stop bleeding. Imagine your platelets are the emergency repair crew for your blood vessels. When there's a tiny leak or a bit of damage, they rush to the scene and plug the hole. High-dose vitamin E essentially tells this crew to stand down, Now let us pair this with what happens when you sleep. At night, your blood pressure naturally dips and rises, and your heart rate slows. Your circulation is not as vigorous as when you are walking around during the day. This combination of slower circulation and suppressed platelets creates a treacherous environment. It can lead to two opposite but equally dangerous outcomes. On one hand, if a small, weak blood vessel in the brain were to tear slightly, your body's ability to form a quick protective clot is compromised. This can lead to a hemorrhagic stroke or a silent bleed that grows slowly through the night. On the other hand, the altered blood dynamics and slower flow can paradoxically create turbulence in the arteries, which can sometimes encourage a different kind of clot to form, especially if your arteries already have some plaque buildup. This risk is amplified enormously if you are already taking prescription blood thinners like warfarin, aspirin, or clopidogrel. I remember a gentleman, let us call him Robert, a retired teacher who was incredibly proactive about his health. He was on a low-dose aspirin prescribed by his cardiologist. Unbeknownst to his doctor, he had also started taking 800 IU of vitamin E every evening, believing he was giving his heart extra protection. One morning, he woke up with a splitting headache and confusion. He had suffered a small hemorrhagic stroke during the night. The combination of the aspirin and the high-dose vitamin had thinned his blood to a dangerous degree. His well-intentioned effort had nearly cost him his independence. This is the silent danger of vitamin E. It works on the very system that is meant to protect you at the very time your body is least prepared to handle the imbalance. Moving on to our next vitamin, let's talk about the B vitamin family, specifically vitamin B6, also known as pyridoxine. Vitamin B6 is crucial for so many functions. It helps with metabolism, brain development, and immune function. It's a true workhorse in our bodies. Because it's so important, it's often included in high doses in B-complex supplements and multivitamins, particularly those marketed for energy and nerve health. However, there is a dark side to high-dose vitamin B6 that is not widely discussed, and it directly impacts your stroke risk, especially at night. When you take large amounts of pyridoxine, often more than 100 milligrams a day over a long period, it can become toxic to your nerves. It can cause a condition called sensory neuropathy, where the delicate nerve endings, particularly in your hands and feet, become damaged. You might feel this as numbness, tingling, or a loss of sensation. But how does this connect to a stroke while you sleep? The damage isn't just limited to the nerves in your limbs. This neurotoxicity can also affect the autonomic nervous system, the system that controls all the things you don't think about, like your heart rate, digestion, and, most importantly, your blood pressure. When these regulatory nerves are damaged, your body's ability to manage blood pressure becomes erratic. It can't adjust properly to changes in your position or activity level. During the day, you might notice this as dizziness when you stand up too quickly. But at night, this instability becomes a hidden menace. As you sleep, your body goes through different stages, and your blood pressure should follow a predictable pattern of dipping and rising. If the nerves controlling this process are damaged by excess B6, that pattern can be thrown into chaos. You can experience sudden, unprompted spikes or drops in blood pressure throughout the night. A sudden spike can put immense stress on the blood vessels in your brain, potentially causing an aneurysm to rupture or damaging the arterial walls, leading to a clot. A sudden, sharp drop can also be dangerous, as it might mean that not enough oxygen-rich blood is reaching the farthest parts of your brain, leading to an ischemic stroke. Think of it like this. Your blood pressure regulation system is supposed to be like a smooth cruise control for your body. High-dose vitamin B6 damages the wiring of that system, turning it into a jerky, unpredictable ride with sudden accelerations and braking. When that happens in the delicate vessels of the brain while you're asleep and unaware, the consequences can be catastrophic. The tragedy here is that people often take high-dose B6 to help with nerve issues, not realizing they could be causing a much more dangerous systemic nerve problem that creates the perfect conditions for a nighttime stroke. Let's continue within the B vitamin family and discuss a very popular one, vitamin B12. This vitamin is famous for its role in creating red blood cells and maintaining energy levels. As we age, our ability to absorb B12 from food can decrease, so supplementation is extremely common and often very necessary for seniors. Many people feel a remarkable difference when they correct a B12 deficiency. They have more energy, better focus, and improved mood. Seeing these positive results, it's easy to fall into the more is better trap. People start taking very high doses, sometimes thousands of micrograms, often in formulations designed for a quick energy boost. And taking this energy vitamin in the evening seems like a good idea to some, hoping to wake up refreshed. This is where the risk emerges, particularly for anyone with a pre-existing heart condition, like atrial fibrillation or high blood pressure. While B12 is essential, a megadose of it acts as a powerful stimulant to your cardiovascular system. It's not a gentle nudge. It is a command to ramp up activity. When you take this right before bed, you are essentially telling your heart and circulatory system to run a race at the exact moment they are supposed to be entering a period of calm and recovery. This overstimulation at night can cause your heart to beat faster and, more dangerously, more erratically. For someone with a tendency towards an irregular heartbeat, this can trigger episodes of atrial fibrillation while they sleep. During atrial fibrillation, the heart's upper chambers quiver instead of beating effectively, which can allow blood to pool and form clots. A clot formed in the heart can then travel to the brain, causing a massive ischemic stroke. I once had a patient, a lovely woman named Margaret, who had her atrial fibrillation well controlled with medication. She started taking a high-dose B12 supplement every night after dinner because she read it would help her memory. A few weeks later, she was rushed to the emergency room after suffering a stroke in her sleep. Her heart monitor showed she had been in and out of atrial fibrillation for hours during the night. While we can never be 100% certain of the cause, the timing strongly suggested that the nightly jolt of B12 was overstimulating her heart, overriding the calming effects of her medication, and creating the ideal environment for a clot to form. Her heart was being pushed into a state of chaos while the rest of her body was trying to rest. For a healthy heart, this might not be an issue, but for an aging heart, or one that already has some underlying vulnerabilities, a high dose of B12 at night is like throwing gasoline on a fire. It creates a turbulent, clot-promoting state inside your most vital organ while you lie peacefully in bed, completely unaware of the danger. Now let us turn to the sunshine vitamin, vitamin D. There has been a huge and justified push for people to be aware of their vitamin D levels. It is absolutely critical for bone health, immune function, and countless other processes. So many of us, especially in colder climates, are deficient and need to supplement. But once again, the danger lies in the dose and the timing, particularly when taking it in the evening. Vitamin D's primary job is to help your body absorb calcium from your diet. When you take a high-dose vitamin D supplement, say 5,000 IU or more, it signals your intestines to pull in a large amount of calcium from your last meal. If you take this in the evening, you are essentially flooding your bloodstream with a surge of calcium right before you go to sleep. So what does this surge of calcium do in your bloodstream overnight? Think of your blood as a river that needs to flow smoothly. Calcium in excess acts like a thickener. It makes the blood more viscous or thicker, and it also makes platelets stickier and more likely to clump together. Now combine this with the changes that naturally occur during sleep. Your circulation slows down, and your blood vessels, especially if you're older, may already be narrowed by some degree of atherosclerosis or plaque. You are creating a situation where thicker, stickier blood is trying to move through narrower pipes at a slower speed. This is a classic recipe for a blood clot. The blood simply isn't moving fast enough to clear out any small clumps that might form, allowing them to grow and potentially block a crucial artery in the brain. It's like pouring sludge into a plumbing system that is already old and partially clogged. I often use this analogy with my patients. Taking high-dose vitamin D in the morning is like giving your body the building blocks for your bones when you are active and your circulation is robust, helping to deliver that calcium where it needs to go. Taking that same high dose at night is like dumping a load of wet cement into your bloodstream right before everything slows down, giving it a chance to harden and clog the works. For seniors whose arteries may already be less flexible, this nightly surge of calcium can be particularly risky. It places a silent, unnecessary stress on the entire circulatory system, increasing the likelihood of a clot forming in the deep, quiet hours of the night. Next, we must discuss vitamin K2. This vitamin has gained enormous popularity recently, and for good reason. It plays a wonderful role in directing calcium out of the arteries and into the bones, where it belongs. It's often paired with vitamin D to ensure that the calcium we absorb is used properly. It sounds like the perfect heart protective vitamin, doesn't it? And for many people, it is. But for one specific group of individuals, taking vitamin K2 can be one of the most dangerous things they can do. This group includes anyone taking a prescription blood thinner, especially warfarin, which is also known as Coumadin. The way warfarin works is by blocking the action of vitamin K in the body. It intentionally creates a state where the blood is less able to clot to prevent strokes in people with conditions like atrial fibrillation. The dosage of warfarin is incredibly precise. Doctors monitor it carefully with blood tests to keep the patient in a very specific therapeutic range. Now imagine what happens when a person on warfarin starts taking a vitamin K2 supplement. They are, in effect, taking the direct antidote to their medication. The vitamin K2 supplement floods their system and completely counteracts the effect of the warfarin. Their blood, which was being kept intentionally thin and less likely to clot, suddenly becomes thick and prone to clotting again. This is a ticking time bomb. The protective effect of their life-saving medication is completely neutralized, and their underlying risk of forming a clot shoots right back up, or even higher. It's like being in a small boat with a known leak, and warfarin is the person bailing out the water to keep you afloat. Taking vitamin K2 is like telling that person to take a break and sit down. The water will start flooding in immediately. The danger is profound because it happens silently. The person feels no different. They think they are doing something healthy by taking K2 for their bones and arteries. But inside their body, their blood is returning to a dangerous, clot-prone state. A clot can form in the heart, travel to the brain, and cause a devastating stroke overnight. I had a patient whose warfarin levels had been stable for years. Suddenly, his blood tests showed his blood was becoming thicker. I asked him time and time again if he had changed his diet or started new medications. He said no. Finally, after some careful questioning, his wife remembered he had started taking a new bone health supplement she bought for him. We looked at the label, and there it was, a significant dose of vitamin K2. He had no idea he was systematically canceling out his most important medication every single day. We stopped the supplement immediately, and his levels returned to normal. He was lucky. For anyone on a blood thinner like warfarin, taking vitamin K2 without explicit and careful management by their doctor is like playing Russian roulette with their health every single night. Let's talk about a vitamin everyone believes is completely harmless: vitamin C. We take it for colds, for our immune system, as an antioxidant. We see it in everything from orange juice to high-dose powders and pills. How could something so common possibly be a risk? Again, the secret is in the dose, especially when we talk about the mega doses that have become popular, sometimes thousands of milligrams at a time. A mega dose of vitamin C has a powerful osmotic effect. In simple terms, this means it draws water. When you ingest a very large amount of vitamin C, it pulls fluid from your body's tissues into your intestines. This is why very high doses can cause diarrhea. But it's also pulling fluid from your bloodstream. This has a dehydrating effect on your entire circulatory system. It concentrates your blood, making it thicker and more viscous, much like the effect we discussed with high calcium levels from vitamin D. Now picture taking this mega dose in the evening. You go to bed, and for the next 8 hours, you are not drinking any water. Your body is already naturally losing fluid through breathing and slight perspiration. On top of that, you have this powerful dose of vitamin C actively pulling water out of your bloodstream. Your blood volume decreases, and what remains becomes thicker, more concentrated, and slower moving. This slow, syrupy blood flow is, as we've established, a major risk factor for clot formation in aging arteries. It is like trying to pump honey through a thin straw. The movement is sluggish, and any obstruction can quickly become a total blockage. Dehydration is a known and significant risk factor for stroke, and taking a mega dose of vitamin C before a long period of not drinking, which is what sleep is essentially inducing a state of internal dehydration. I remember a case of a health-conscious man who was a big believer in vitamin C flushes. He would take 5,000 milligrams or more every evening before bed to cleanse his system. He woke up one morning with symptoms of a transient ischemic attack or a mini-stroke. His lab work showed signs of significant dehydration, even though he felt he had been drinking plenty of water during the day. His nightly megadose was leaving him dehydrated and vulnerable during the most critical hours. So while a normal amount of vitamin C is vital, these extreme doses, especially at night, are not a harmless wellness trend. They can concentrate your blood and slow its movement, creating the exact conditions that can lead to a clot developing in your brain while you are sound asleep. Finally, we arrive at what might be the most deceptive danger of all, the modern multivitamin. For decades, the multivitamin has been seen as a simple, once-a-day insurance policy for our health, a convenient way to fill any nutritional gaps. But the multivitamins on the market today, especially those targeted at seniors for energy, brain health, or 50-plus wellness, are often not the simple formulas of the past. They have become powerful cocktails of active ingredients, frequently containing high doses of many of the very vitamins we have just discussed. This is where the risk becomes cumulative, creating a silent systemic overload. A single advanced multivitamin might contain 400 IU of vitamin E, 50 milligrams of vitamin B6, thousands of micrograms of B12, and a few thousand IU of vitamin D, plus many other ingredients. A person might take this thinking they are doing one simple, healthy thing, but in reality, they are simultaneously thinning their blood, potentially destabilizing their blood pressure regulation, overstimulating their heart, and thickening their blood with calcium, all at the same time. And if they take this multivitamin in the evening, all of these processes are set in motion during the vulnerable nighttime period. It is a multi-front assault on the body's delicate circulatory balance. The problem is compounded because people often don't stop with just the multivitamin. They might add an extra vitamin D supplement in the winter, or an extra B complex for energy, or some vitamin C for immunity, without realizing they are stacking these high doses on top of what's already in their multi. They don't read the labels carefully to add up the total amounts. This cumulative effect can silently stress the aging circulatory system night after night. Each individual ingredient might not be enough to push them over the edge, but the combined synergistic effect of all of them working at once can create a profoundly pro-stroke environment. It is like a dam with several small invisible cracks. Each one might not seem like a big deal, but together they weaken the entire structure until one night, under the gentle, steady pressure of slowed nighttime circulation, the dam breaks. This is why the innocent-looking multivitamin can be the most insidious risk. It lulls you into a false sense of security, while potentially delivering a nightly payload of high-dose ingredients that work against your body's natural rhythms. So what do we do with this information? As I said at the beginning, this is not about creating fear or telling you to throw away all your supplements. It's about shifting from a mindset of blind faith in vitamins to one of informed respect for their power. It's about becoming a wise and cautious partner in your own health. The most important points to take away from our discussion today are simple, but they can be life-saving. First, and this is non-negotiable, you must consult your doctor or a qualified healthcare provider before adding or combining any supplements, especially if you have existing health conditions or are on any medication. Do not self-prescribe. Second, as a general rule, avoid taking strong, high-dose vitamins in the evening. Take them in the morning with breakfast when your body is active and your circulation is robust. Third, become a meticulous label reader. Know what is in your supplements and, most importantly, know the dosage. Add up the totals from all the different products you take to ensure you are not creating a cumulative overload. And finally, one of the simplest yet most protective habits you can adopt is to maintain adequate hydration, particularly in the evening. Having a small glass of water before bed can help counteract the natural thickening of the blood that occurs overnight and support healthy circulation. Your health, your brain, and your independence are your most precious assets. Protecting them doesn't always require a brand new therapy or an expensive pill. Sometimes it simply requires wisdom, caution, and a deeper understanding of how to work with your body, not against it. By making these small, informed adjustments to your routine, you can ensure that when you lay your head on the pillow each night, you are truly setting the stage for healing, restoration, and a safe passage to a bright new day. Thank you for sharing this time with me. Your health is worth this knowledge. Take care of yourselves and be well.